And welcome back, everyone, here to Live Now from Fox. I'm your host, Mike Page. Always great to be here with you. Well, some new numbers released today by the CDC regarding overdose deaths here in this country from last year hit an absolutely horrible number, surging more than 30% to 93,000 overdose deaths regarding this COVID-19 pandemic. So we're going to get a little bit more insight. Right now, we are joined on the phone by Dr. Nicole Saphier, Fox News medical correspondent. And Dr. Saphier, this is some unfortunate new numbers.
I mean, more than unfortunate. I mean, they're devastating. But I can tell you, it's not a surprise. This is something that we have been talking about for the last year and a half. We knew that as a resultant of the lockdowns, the continued restrictions, the closures of businesses, and keeping young adults out of their social settings, that we were going to see a rise in substance abuse. And these numbers just confirm that.
And Dr. Saphier, what do you think going forward? We haven't really even seen, I mean, these numbers are shocking, 93,000, but going forward, what are some other things that we are going to see from these lockdowns that happen and these restrictions from the past year?
Well, it's important to note that drug overdose deaths have been on the rise for the last couple of decades, but they have gotten significantly higher with the introduction of the laced fentanyl and other illegal opioids. But specifically as a result of some of the measures from COVID-19, I mean, we started seeing earlier data out of Fair Health that showed that there was increased suicides, domestic violence, more mental health visits to physicians. And so we're really going to start seeing the consequences, specifically how they pertain to mental health, from the lockdowns. But it's not just that. It expands it's going to go to physical health, too. Yes, we're doing a great job at tackling COVID-19, but we have to think of the undiagnosed cancers, those who didn't go and get their regular checkups and now maybe have undiagnosed heart disease or lung disease. I mean, we're going to start seeing more of these over the next couple of years of the ramifications from people not seeking medical care.
And what about also, what I felt like was never really touched upon a lot during the pandemic was the elderly, and they had to be so lonely at really at all stages of the pandemic. I mean, what happens with their mental health as well?
Oh, undoubtedly. I mean, as it stands already, senior citizens have a high prevalence of depression, feeling isolated. And I can tell you, with all the measures that took place in the nursing home facilities and people wanting to protect their elderly relatives and the elderly relatives being scared themselves, they had more social isolation than they probably ever had in their lives. And so maybe that contributed to some of the high level of hospitalizations and deaths as they pertain to COVID-19. I think it's going to be very hard to come back from some of those who have become severely depressed and have lived in a state of fear and panic for the last year and a half.
And Dr. Saphier, could it be that when the history books are written, we look maybe even 10, 20 years down the line, and when we talk about these restrictions that people had as far as can't leave the home, there was a lot of lockdowns, is it almost going to be like we put a Band-Aid on that situation for the time being, but we almost theoretically amputated a leg to have a scratch on the arm?
I mean, that's a great analogy, and you're right. At the very beginning, when we didn't know much about the virus, we didn't know where it was spreading, and we didn't have an ability to test for it, we didn't have a way to treat it, some of those lockdowns were understandable. But quickly, we realized a lot more about this virus, and when there were calls for people to stop having so many restrictions, even the summer of 2020, the people that continued with the measures, the keeping children out of schools, the continued mask wearing, the continued closures of businesses, we're going to look back and see that those were the biggest failures of our country, and those consequences will likely outweigh that of the virus itself.
Unfortunately, it feels like there will be a lot of lingering problems that come from this. Talking a little bit more about the drug overdoses, did we just find people, because of this surge there, that we see 30% a rise from the previous year? Was it where people are just feeling helpless? They were in a new environment as far as they couldn't see maybe their friends, their social functions were pretty much stopped completely. Is that why we've seen a new realm of this?
Well, we're going to need to look at the data a lot more to see exactly where these rising cases occurred, but it's multifactorial. So first of all, people who are in treatment for opioid use, are on methadone. A lot of people are on methadone or a similar type of medication, and typically, historically, prior to COVID-19, they would actually have to physically go to the clinic every day to get that medication. And that was a good check and balance system. Well, during the pandemic, because we were trying to lessen in-person contact, they were actually being given 4-week supplies of their medications. Now, is it possible that they were relapsing because they weren't having that in-person contact? Were they overdosing? It's hard to tell, but that's a possibility. Yes, of course, the rise in depression and unemployment absolutely has contributed to substance abuse and those overdoses as well. We've also taken a step back at focusing on border security and national security about trying to keep the illegal fentanyl from entering our borders. And so there's a lot of things that have contributed to this. And right now we have more people dying from drug overdoses every single day than we do COVID-19. Yet the only narrative remains COVID-19. So it's time to broaden that narrative and really start focusing on saving lives.
Yeah, those are some really interesting and great points that you made. We're seeing now with the White House where they want to reach out to social media influencers talking about getting the COVID-19 vaccine and even maybe going door to door in some places to try to really get the word out. But should the really message be taken for drug overdoses and really make that the big push like we saw back in the 80s?
Adolescents are at infinitely more risk of dying from substance abuse, overdose, and mental health crises than they are from COVID-19. And so while I implore that they continue to use certain measures for public health promotion for COVID-19 vaccination, I think that they need to actually focus on what they can do to save the most amount of lives. And I can tell you, TikTok, all of the social media in themselves, that's also contributing to mental health issues in our adolescents. So I understand. I think the impetus behind it is good, but I think they need to be smarter and they have to really make bigger moves to save our younger generation.
Very, very good points there. And lastly here, Dr. Saphier, for people that may be struggling with a addiction, alcohol, drug, at this point now, what are some of the ways that they could reach out for help?
So listen, people can be addicted to anything, and it's certainly not something that should be stigmatized or shamed, whether you're addicted to social media, alcohol, any sort of drug, whether it's legal or illegal. The first step is to tell someone, whether it's a friend, a family member, your physician. And if you don't feel comfortable telling someone, there are a plethora of hotlines available. You just Google hotlines. There are suicide hotlines, drug hotlines. There are always people there to help you. And you have to not be afraid or ashamed, because the first step is just admitting you need help. And I can tell you, there are a lot of people around you who need the exact same type of help.
I think that is really well said to end this interview, where you don't know until you either reach out or ask somebody how they're truly feeling, because they're not going to want to say really what's on their mind, because they think that they're going to be shamed for it, especially now with social media out there, especially.
Exactly, and I can tell you one of the biggest detriments in society is that people feel stigmatized because of addiction, because of mental health issues, and we need to, as a nation, start viewing them as more likened to a diabetes or a cancer, because mental health is also physical health, and you can't have one without the other.
No, not at all there. Dr. Nicole Saphier, Fox News medical correspondent, thank you so much for taking time and really giving us some insight on these horrible numbers that came out today with the drug overdoses. We appreciate it.
Absolutely. Thanks for having me.
No problem. Have a great one. And we continue on right here on Live Now from Fox. We'll continue to monitor everything that is